the development of aortic arch arteries, superior vena cava, inferior vena cava, coronary sinus, and we will also discuss the barium swallow. So in this we discuss the competency, that is development of aortic arch arteries, superior vena cava, inferior vena cava and coronary sinus. So you are seeing the aortic arch and the dorsal aorta. So there are 6 aortic arches and 2 dorsal aorta. So coming to development of arch of aorta. So arch of aorta develops from left ventral aorta between 4th and 6th aortic arches as shown in the figure. Then left 4th aortic arch. Then left dorsal aorta caudal to 4th aortic arch. These structures give the development of arch of aorta. When the pharyngeal arches form, each aortic arch receives its own nerve and its own artery. These arteries are aortic arch arteries. They arise from aortic sac, which is the most distal part of truncus arteriosus as shown in the figure. Aortic arch arteries terminate in the right and left dorsal aortae. In the region of pharyngeal arches, dorsal aorta remain paired, but caudal to this, they fuse to form a single vessel. Pharyngeal arches and their vessels appear in a cranio-caudal sequence. Aortic sac contributes a branch to each arch as it forms, giving rise to a total of 5 pairs of arteries. The 5th arch either never forms or forms incompletely and then regresses. So the picture showing the different structures emerging from arch of aorta or aortic arch arteries. The aortic sac forms right and left horns, which subsequently give rise to brachiocephalic artery, the proximal segment of aortic arch respectively. Then coming to aortic arch arches, the first and second aortic arch disappear. The 3rd, 4th and 6th are large. With the division of the coronotruncal region of the 6th arch is continuous with the pulmonary trunk. With the division of coronotruncal region, the 6th arch is, or 6 arches are continuous with pulmonary trunk. So you can see the different structures emerging from the different aortic arch arteries. The 3rd aortic arch forms the common carotid artery and the first part of internal carotid artery. The external carotid artery is a sprout of the 3rd aortic arch. In the picture you can see the development of the 3rd aortic arch giving rise to, which is in red color, gives rise to internal carotid artery, common carotid artery, and a sprout will give rise to external carotid artery. 4th aortic arch. The 4th aortic arch persists on both sides. On the left, it forms part of arch of aorta between the left common carotid and left subclavian arteries. On the right, it forms the proximal segment of right subclavian artery. The 5th aortic arch either never forms or forms incompletely and then regresses. So you can see the 4th aortic arch giving rise to the part of aortic arch of aorta, that is between left common carotid and left subclavian. On the right, you can see that it is giving rise to proximal part of right subclavian artery. Sixth aortic arch. The sixth aortic arch is known as pulmonary arch. On the right side, the proximal part becomes the proximal part of right pulmonary artery. The distal portion of this arch loses its connection with dorsal aorta and disappears. On the left, the distal part persists during intrauterine life as ductus arteriosus. So the picture showing the venous drainage, that is all will drain into sinus venosus. There are anterior cardinal veins, then posterior cardinal veins. So they are joined to form the common cardinal vein. So this is the venous drainage during the embryo stage. Then initially the cardiac veins form the main venous drainage of the embryo. This system consists of anterior cardinal veins draining the cephalic part of embryo and posterior cardinal veins draining the rest of the body. The anterior and posterior veins join before entering the sinus venosus or sinus horn and form short common cardinal veins. During the 5th to 7th weeks, a number of additional veins are formed. First, the subcardinal veins form to drain the kidneys. Then second, the sacrocardinal veins form to drain the lower extremities. Third, supracardinal veins form to drain the body wall by way of intercostal veins. All these additional veins take over the function of the posterior cardinal veins. Formation of the vena cava system is characterized by appearance of anastomosis between the left and right sides in such a manner that blood from the left is channeled to the right side. Anastomosis between the anterior cardinal veins develops into right and left brachiocephalic vein, as we can see in the picture. Superior vena cava formation. Superior vena cava is formed by right common cardinal vein and proximal portion of right anterior cardinal vein, as shown in the picture. Inferior vena cava. Anastomosis between the subcardinal veins form the left renal vein. When this communication has been established, the left subcardinal vein disappears and only its distal portion remains as the left gonadal vein. Renal segment. Right subcardinal vein becomes the main channel and develops into renal segment of inferior vena cava. So the picture showing the different venous systems and development of the inferior vena cava. Sacrocardinal segment. Anastomosis between sacrocardinal veins form the left common iliac vein. The right sacrocardinal vein becomes the sacrocardinal segment of inferior vena cava. Hepatic segment. Renal segment of the inferior vena cava connects with the hepatic segment. Hepatic segment is derived from right vitelline vein. So, inferior vena cava consists of hepatic segment, renal segment, sacrocardinal segments when it is complete. Development of inferior vena cava. So, cardinal veins are responsible to drain the body. The cranial part of the embryo is drained by paired anterior cardinal veins. The caudal part of the embryo is drained by paired posterior cardinal veins. Anterior posterior cardinal veins join to form common cardinal veins which drain into sinus venosus. Anterior cardinal veins become connected by an anastomosis which shunts blood from left to right. This anastomosing channel becomes the left brachiocephalic vein. The left anterior cardinal vein, cranial part becomes left internal jugular vein, the caudal part degenerates. Right anterior cardinal vein, the cranial part becomes the right internal jugular vein. Middle part gives rise to right brachiocephalic vein. The caudal part of the right anterior cardinal vein and the right common cardinal vein form the superior vena cava. Gradually, the posterior cardinal veins are replaced by two new veins, that is subcardinal and supracardinal veins. Subcardinal veins appear before supracardinal veins, become connected to each other by subcardinal anastomosis. Adult derivatives of the subcardinal veins are stem of the left renal vein, suprarenal veins, gonadal veins, and prerenal segment of inferior vena cava. Supracardinal veins, last pair of veins to develop, appear lateral to subcardinal veins, become connected at both ends to the posterior cardinal veins, get disrupted in the region of kidney. Cranial to kidney, an anastomosis develops between the two veins shunting blood from left to right and give rise to azygous and hemiazygous. Caudal to kidney, left vein degenerates, right vein forms the post-renal segment of inferior vena cava. So, inferior vena cava development, the IVC develops during a series of changes in the primordial veins composed of hepatic segment derived from right vitelline vein, prerenal segment derived from right subcardinal vein, renal segment derived from subcardinal and supracardinal anastomosis, postrenal derived from right supracardinal vein. So that shows the development of the inferior vena cava. Then barium swallow, another competency. So in the picture you can see the X-ray picture of the barium shadow or barium swallow, where you can see the different constrictions of the esophagus. That is starting with the left bronchus, then arch of aorta. So barium sulfate is a metallic compound that shows upon X-ray. It is used to help see abnormalities in the gastrointestinal tract. Barium swallow is generally a safe test, but like any other procedure, there are occasional complications. Following are some of the complications: allergic reaction, constipation, then accidentally aspiration of barium into trachea can occur. Barium swallow preparation: a low fiber diet for 2 to 3 days before the barium swallow test. Not to eat or smoke after midnight before the exam. To remove all jewelry, including body jewelry, dentures, hair clips and other objects that might show up on X-ray. Then during the procedure, drink about 1.5 cups of barium preparation, a chalky drink with the consistency of milkshake. The barium swallow procedure may take about 30 minutes to finish. The X-ray is taken as the barium moves through the digestive system. Normal diet is given after the barium swallow. Normal diet is given because the barium is white. Stools will be chalky and light colored for 1 to 3 days. Advised to drink lots of fluids to help alleviate the constipation, and eat food with lots of roughage and fiber such that raw fruits and raw vegetables. Thank you.